So we're going to talk about a common exercise that you will hear about to decrease low back pain. It's called the Pelvic Clock, and it's been adapted from Moshe Feldenkrais, who did a lot of awareness through movement exercises. So it's very much a flowing kind of exercise that helps to decrease low back pain. In this position, I'm going to ask Kate to tell me if she has any sort of pressure anywhere in her body. Kate, any tightnesses anywhere?
I think I feel a little bit of tightness on my right leg QL.
Okay, lower back?
Uh-huh.
Okay. So we're going to take that and then we're going to have Kate do this exercise. So she's going to engage her abdominals slightly, just a gentle pulling in, bend her right knee up. Good, bend her left knee up. And then she's going to start an exercise known as the pelvic clock. Many of you are probably frequently used to that concept of the pelvic tilt. So this is a variation of this, but a little bit easier. So what I want Kate to do is, with the least amount of effort, to roll her pelvis up to 12 and down to 6. And as she's doing this, she's getting an idea of just an easy motion, sort of like you're rocking the pail. And I want her to just do it nice and easy and not feel like there's any tension in her back, doing the least amount of effort, not gripping in her butt. And so she'll just keep doing 12 and 6. Then I'm going to have her start to do a little bit of a diagonal motion. So instead of going straight up to 12, I'm going to have her just come to 1 o'clock. So 1 o'clock and then just back to neutral. So up to 1 o'clock and then neutral. And I'll have her do that a few times. And then she's going to start to go around the clock, 2 o'clock and neutral. So 2 o'clock and neutral. And she's just going to start to work that angle into 2. And then straight over to 3. And you're getting the idea here. We're just working on the different motions in a smaller range of motion down to 4 o'clock. And this is a great exercise because now you can start to feel where you're tight. If you have restrictions or there's pain, do not push through that. Keep the motion a little stronger. Now go to 5 o'clock. And then straight down to 6. Good. And she keeps going around the clock. So she's going to go to 7. She's going to go to 8. She's going to do all the numbers, going from the number back into the center of the clock in neutral. And as she's doing that, she's just going as far as she can where it feels comfortable. And this is a great exercise to improve the curve of your lumbar spine and really decrease that pain that you have in your lower back. It's great for that. Now she's going to start to challenge herself with diagonals. So she's going to go 12 and 6 to start. So straight up to 12 and 6, which everyone loves 12 and 6. Then we're going to go 1 and 7. So as she's going through 1 and 7, that looks pretty good. And then we'll have her do 2 and 8. And this may sound like an easy concept, but for many people it's very hard when you first do it. You're going to feel incoordinated. But the biggest, most important thing is just to know how far you can go working that angle without feeling like you're upsetting your lower back at all. Go 3 and 9 for me, Kate. Good. And then go 4 and 10. Good. 5 and 11. Back to 12 and 6. And then I want you to do 3 counterclockwise circles and then 3 clockwise circles. And again, doing the least amount of effort, trying to reach all numbers on the clock. Even if you can't reach all numbers on the clock, at least striving for those numbers without any kind of pain or discomfort. Good. And again, it doesn't have to be a huge motion. You're just going through the motion to your level of comfort to improve that mobility. This exercise should last in total about 3 to 5 minutes. After this last one here, I'm going to have Kate slowly extend one leg down, then the other, and assess how that right lower back feels now. And go ahead down. And how does that spot feel now, Kate?
Yeah, feels better.
Good. This is a great exercise to do as a warm-up before you're going to go into a class that's very highly intensive. It makes sure that your spine is mobile in all directions so you don't get hurt.